Today, we're going to tackle something that every single one of us has felt, but maybe don't fully understand. We're going to dive deep into the story of pain, and it's a fascinating one.
So, right off the bat, let's ask a pretty fundamental question. Is pain our friend, or is it our enemy? I mean, we spend our lives trying to avoid it, right? It causes so much suffering. But is that all there is to it?
Well, the truth is, it's both. Pain is this incredible biological double-edged sword. On one side, it is an absolutely essential alarm system. It's designed to protect us, to keep us safe. But on the other side, when that system goes haywire, pain itself can become the disease.
To really get a handle on this, we've got to follow the journey of a pain signal. We're going to trace it from the very first moment of an injury all the way up to your brain. And that story starts with these little guys, nociceptors. Think of them as the microscopic security guards of your body. They're these specialized nerve endings, and they're everywhere, just waiting, monitoring for any kind of potential damage. Too much heat, too much pressure, you name it. They're the ones who sound the alarm.
So once a nociceptor gets triggered, it fires off an electrical signal. That signal then has to travel, and it does so along these superhighways called peripheral nerves. Now, these nerves are basically bundles of different kinds of wiring, but for pain, we're really interested in two specific types, the A delta fibers and the C fibers.
And here's why those two are so important. They create the two distinct feelings of pain we all know. The A delta fibers are wrapped in this fatty sheath called myelin, which is kind of like insulation on a wire. It lets them send signals super fast. This is your first pain, that immediate sharp ow when you stub your toe. But then you've got the C fibers. They're uninsulated, they're slower, and they carry the second pain, that lingering, dull, throbbing ache that sets in afterwards.
So this alarm system is pretty brilliant, right? It keeps us from getting seriously hurt. But what happens when the alarm gets a little trigger-happy? What happens when it becomes way too sensitive?
Well, that's a process called sensitization. You see, when you get injured, your body releases this whole cocktail of inflammatory chemicals right at the site. This chemical soup does more than just cause swelling. It basically soaks the local nociceptors and makes them way more excitable. It lowers the bar for what it takes to get them to fire off a pain signal.
And we've all experienced this. Think about a bad sunburn. The actual burning is over, but the whole area is sensitized. And suddenly, things that should feel good, like a warm shower, or things that should be no big deal, like a friendly pat on the back, become unbelievably painful. That right there is sensitization in action. Doctors have a name for it, allodynia, pain from something that shouldn't cause pain at all.
Okay, so let's zoom out and look at the whole map. An injury happens. The signal travels up those A delta and C fibers and hits the spinal cord. There, it's like catching a connecting flight. It hops onto a new pathway called the spinothalamic tract, which is basically an express elevator straight to the brain. The signal makes a quick stop at the thalamus, the brain's grand central station, before finally arriving at the cortex. And it's only there, in the cortex, that we actually perceive the sensation we call pain.
So that's how the alarm is supposed to work. But what if the problem isn't the thing setting off the alarm? What if the problem is the alarm system itself? Well, that leads us to a whole different world of pain.
And this is a really, really important distinction to make. The pain from a cut or burn, that's called nociceptive pain. The alarm is working just fine. But neuropathic pain, that's different. That's pain caused by actual damage to the nerves themselves. It's not the alarm, it's faulty wiring. The system starts sending pain signals all on its own, even when there's no injury to report. And because the nerves themselves are the source, the pain feels totally different. People will describe it using really specific words, like a burning sensation, or tingling, pins and needles, or even like an electric shock. And you know, this isn't just creative language. For a doctor, hearing those words are huge diagnostic clues. They immediately point away from simple tissue damage and towards a problem with the nervous system.
And that's exactly why a doctor's most powerful tool, honestly, is just listening to how you describe your pain. It's all about decoding the story that the pain signal is trying to tell.
So a doctor is listening for these key characteristics. The quality, like we just said, is it sharp or is it burning? That helps tell them what kind of pain it might be. The location obviously helps pinpoint the area. The time course, is this brand new or has it been going on for 6 months? That completely changes the game. And what makes it worse? You know, if it only hurts when you move a certain way, that suggests a mechanical problem. Every answer is another piece of the puzzle.
So once the puzzle starts coming together and a doctor has an idea of what's going on, the next step is to try and control that signal. And that's where pain management comes in. It's a massive field with tons of different strategies, all trying to interrupt or change that pain signal's journey.
Now, when we talk about medications, different drugs have different missions. You've got NSAIDs like ibuprofen. Their job is to work at the site of the injury and reduce that inflammatory soup that makes nerves so sensitive. Opioids are really potent, and they work up in the brain and spinal cord to block the signal. And for that faulty wiring of neuropathic pain, doctors often use anticonvulsants. Yep, seizure medications, because they're great at calming down those overexcited nerves.
But it's not all about pills, not by a long shot. The best approach involves a whole team. Physical therapy can fix the underlying mechanical issue. Things like nerve blocks can go in and silence one specific misbehaving nerve. And there's even amazing tech like spinal cord stimulators that can essentially use a different electrical signal to cover up the pain one.
All of these strategies are what we'd call bottom-up. They attack the pain from where it starts and work their way up. But maybe, just maybe, the most powerful pain control center in the entire universe is the one you're carrying around with you right now, your own brain.
And this is just incredible. This shows us the top-down system. These are brain scans showing what happens during the placebo effect. Just the belief that you're getting relief activates parts of your brain. And those parts then send signals down the spinal cord, essentially closing the gate on incoming pain signals before they can even get to your conscious brain. This isn't just wishful thinking. It's real, measurable, biological pain control powered entirely by your mind.
Which leaves us with a final, massive question. We've seen how pain can be a simple alarm or a complex disease. We've seen how we try to manage it from the bottom up. But if our own minds have this built-in top-down system for turning down the volume on pain, what does that mean for the future? Can we learn to harness that power and maybe, one day, truly conquer chronic pain?